Welcome to the Birds and the Bees podcast. This is Braxton Dutson.
That's the key. People aren't talking about it.
Everybody needs to know that porn is not a documentary.
It's not like if we don't talk to kids about sex and sexuality, they're not going to hear about it. They're just not going to hear about it from us.
They have tons of questions, they just don't know how to ask them.
All you have to do is be one chapter ahead. You don't have to know everything. Just one chapter ahead of wherever your child is.
Welcome to Birds and Bees podcast. This is Braxton Dutson. I'm a certified sex therapist in Salt Lake City, Utah. I'm so excited to get to the interview today. It's a little bit longer than usual. It's going to go for roughly an hour and 15 minutes, but it's full of a story about Devin and Cami, who've gone through the NICU with their fourth child. And Devin's a therapist. Cami works for a hospital that also works with the team members that work in the NICU and the therapists that work in the NICU as well. And so they have a lot of insight that I'm excited to give to you today. We go over life still going on, the guilt that you can be feeling from being away from baby, as well as trying to balance the life that goes on while you're in the NICU, how you can advocate for yourself, and the paradox that you experience with sometimes feeling like you're grieving a living child. That do you feel connected with them? How can you feel connected with them? Is it something that you're supposed to do? How do you attach to this child and the emotional cycles that you go through? Cami also shares some of the Instagram pages that have really helped her and Devin continue to find their closure and what helps them get to their closure from their visits to the NICU. One of them that she talks about is Minnie to Moose, and the other one is Miracle Mama, and they're all on Instagram. So I encourage you to go check them out, as well as check out the resources that they share towards the end of the episode. One of the things that I'm going to post on the blog at birdsandbeespodcast.com is all of the resources that they talk about. So we're going to get right into the interview. Please, if you like this episode, send this to your friends, give us a review, but we're going to get right into it. So thank you for tuning in to Birds and Bees Podcast. I'm excited you're here. Welcome to Birds and Bees Podcast. This is Braxton Dutson, and today I'm here with Devin and Cami. I'm real excited to have you guys here. Cami, welcome to the show.
Thank you. I'm excited too.
Devin?
Hi, thanks.
Yeah, I'll pretend like we haven't met before. Devin and Cami, they're actually neighbors of mine, and me and Devin went to school we were just intern buddies, and
Yeah, we were two peas in a pod all through bachelor's and graduate school, right?
for real.
Same internships.
School husbands. That's what Cami refers to us as, because we saw each other more than we saw
Our own families.
our own families.
Yep.
Yeah,
You did.
it's really true. There was a lot of experiences that way.
And then you became neighbors.
Yeah. You guys bought a house at the very beginning, and then towards the end of right as soon as we graduated, we bought a house out here, and happened to be just a mile and a half away from each other.
Yeah, it's been perfect.
Yeah. So I'm glad to have you guys here. I'm really excited.
We're glad to be here.
Well, what we're going to be talking about today is something that's close to Devin and Cami's heart, and an experience that they've had. So, Cami, you approached me a little bit ago talking about how you listened to episode 5 and episode 20, which is about, one was about postpartum, or no, you got to remind me.
Pregnancy loss and infertility.
Pregnancy loss and infertility.
Yeah.
And then sex and infertility.
Yeah,
I believe.
sex and infertility. Yep.
And you had so many great ideas and thoughts about, one, your experience in going through being in the neonatal. What is that? What does NICU stand for?
Neonatal Intensive Care Unit.
Neonatal Intensive Care Unit, the NICU. So I'm going to keep referring to it as the NICU. We had some wonderful ideas or thoughts about how people who've gone through your experience are also being overlooked. And I was like, that's really true. And the more and more I've talked to people, there's so many stories. I've asked other people, or I've said, hey, yeah, I'm going to do one on, being in the NICU. And almost every person I've said that to have been, I went through that too. Like, this happens so often.
It does, unfortunately. So, but yeah, so our story, we have 4 kids, and the first pregnancy was fine. no problems. She was 40 weeks and perfect. And then our second and third pregnancies were a little more complicated. Our second pregnancy was born at 35 weeks, and then our third pregnancy was born at 36 weeks. But the 36-week, my third pregnancy, I was on bed rest for 10 weeks. Wow. And I was just going into preterm labor. And it was just a little more complicated. So with our fourth pregnancy, we talked to the doctor even before we got pregnant. We want to try and prevent some of these things to happen again, and what some steps we need to take, and kind of help us so that it doesn't happen again. I think it was really good of us to be informed and take precautions, because then the fourth pregnancy ended up being way crazier than we could have even planned for or imagined.
Wow. Well, and you work in at that time you were working in billing, and now currently, tell me where you're working at now.
So right now, I work at the hospital on the care management team, and so it's working with nurses and social workers, helping anybody on the floors. There's a NICU unit. There's on the patient tower and heart and lung tower that they help with anybody that might need needs or have care that they need at home, discharge planning and things like that.
Which is what I'm really excited to have you on for as well, because we've got kind of an inside. You've experienced this. You also work in this realm. And then Devin, you're a therapist.
Yeah, I kind of do two things, because us social workers like to do lots of stuff and be over involved. But yeah, I work inpatient social work at the University Hospital Neuropsychiatric Institute, working with teens and adults in day treatment, all the above, wherever they need help. And then I also work as a crisis worker at Primary Children's Hospital, crisis social work, involving, suicide assessments and also any type of crisis that comes in as far as like accidents or just any trauma. So,
yeah.
And you went through this as a dad, which I'm very interested to get your take as dad going through this whole process. And were you taking Cami to the hospital, or?
No, she was already there, because this was after, one of the multiple scares during this pregnancy, but she was there because her water had broke already. And we were driving there because she had called me in this frantic and said, "Devin, you need to get there right away." And I was like, "What's going on?" And she hung up, and I couldn't get back hold of her, so I was freaking out. So yeah, I got all the kids in the car, and we're running, we're driving. I'm driving like a lunatic because I'm panicked and trying to be safe with the other kids in the car. But there was this other driver that was saw me coming fast, so slowed down. And so then I was like, okay, here goes road rage. So long story short, the funny part of it is, she was like on the side of me, and I'm like trying to gesture that my wife's pregnant, gonna have a baby, like making these like circular motions around her belly. So she probably thought I was just calling her chubby or something. Like, it was not a good situation.
And the kids just remember, Dad was driving fast.
The lady was really honking fast. And she was telling him that she's going to call the cops on him. And
holy cow. So on your end, Cami, what was going on at that point in time?
So going into the pregnancy, we talked to the doctor, and we knew we were going to take progesterone shots. And so what that does is it helps prevent preterm contractions, which is basically what I had with my second and third pregnancy. And so that's really all we were concerned about. So we knew we were going to start that around 16 weeks. And so we found out we were pregnant. We were excited. Made the appointment, and we went to our 20-week appointment, and that's when you do your ultrasound to see what the sex of the baby is. They check your cervix to see the length of it and some other things, just to make sure everything's healthy and growing as should be. And then that's when we got our prescription for the progesterone to do. So we were a little bit late on the game on that. But at that 20-week appointment is when the ultrasound tech was measuring my cervix, and just the look on her face was concerned. I had to drink all the water first, and so then you have like this full bladder, and she couldn't get a right measurement, so then I had to go to the bathroom, come back. She's trying to do measurements still and can't find my length of the cervix. And so then they actually did an internal ultrasound to try and find the length of the cervix, and she took it and said, okay, it's a 1.4 centimeters long. The doctor will be in to talk to you.
Yeah, she didn't have a good poker face.
No, and we were both just looking at each other
there's something wrong.
Okay, that's scary. Like, this has never happened. This is our 4th pregnancy. It's never happened like that before. The doctor came right in, did measurements as well, and said, yeah, this is concerning. Normally a normal 20-week pregnancy, your cervix should be 3.5 to 4 centimeters long, and yours is measuring at 1.4. So that's a high risk of having preterm labor, that your cervix is shortened. And so he immediately put me on bed rest. He sent us home. It was a Friday, and he said, come back on Monday. We're going to do another measurement.
Yeah, to see if it progressed or not.
Yeah. And so we went home. I was on bed rest that weekend. We came back on Monday, and it was measured at 1.2. So it had gone down. So then he immediately said, you're being admitted. You're going to have a cerclage surgery. So that's where they actually stitch your cervix shut. And you're going to be inpatient for a couple days.
So they could monitor if it was continuing, if the stitches were going to allow for it to stay at 1.2 or things like that.
Exactly. Okay. So that's immediately they sent me to the floor. They put me on a bed that my head was lower than my feet because they didn't want any pressure even to be down there to make the cervix go shorter. I went to surgery the next day and then was discharged, I think, later that same day. But then they said, just take it very easy after that. And so I think that was like a big part of, I related a lot to the doctor office. Like, you're excited to go to this 20-week appointment and find out that you're having what sex we're having. We had a girl. And so we were so excited for that. But all that excitement got immediately taken away. You're going to possibly lose this baby. And that was scary.
Yeah.
It was really scary. Dang it.
Cami said that she did not want to cry on the show today.
I didn't want to cry. So then after that, around 25 weeks, we started having weekly appointments with the doctor. He was just really concerned. It was a very high-risk pregnancy from that point going forward, which you normally don't start having weekly appointments till you're 36 weeks. And so it was a lot earlier. Weekly appointments with the doctor. At 27 weeks, I started having contractions constantly. And so that was something that was scary. Again, everything was high alert at that point. Then after that, we had at 28 weeks, we did the lung steroid shot, so it helps the baby's lungs develop.
Does do they give it to the infant, or you get the steroid shot?
I get the steroid shot. Yep. So very painful.
All the while still maintaining these progesterone shots that I was like horrified of giving her because they hurt her every week. I think they were every week. They're not cheap.
No, they're not.
And I'm not certified. Like, the first time I ever gave an injection was on her, and I was like, well, this is really weird.
He's terrified of needles as well, so that was like, get over your fear. You gotta stick a needle in my butt every week. Like,
wow.
Well, and the fluid's so thick that it just hurts no matter what. So I'm like, did I get it in the right spot? And she's like, I don't know. And then it was just like I was like, I hated giving it every week. It made me nauseous every time I had to give it because I know I was going to hurt her no matter what I did.
Oh, man.
So I would cry even though I try not to. It was painful. So, and then, so at our 30-week appointment, they checked me and they said, you're dilated to 2 and you're 90% effaced. And so,
because the cervix was already thin.
The cervix was thin. It was still shortening, and it was at that point now
right to the stitch, basically.
And so they're like,
so they kind of lasso it, like the cerclage helps lasso that the cervix shut, and she was already thin enough, but they said it's probably going to tear because usually we like a little thicker before we even start to sew this up, but we're going to do whatever we can. So they didn't even have as much as they wanted to, essentially. So the bottom of the balloon, like when you tie a bottom balloon is how I imagine it, right? And because essentially it's all just an upside down balloon if you look at anatomy.
Definitely.
So that knot was real close to the end, and everything got lazy is kind of what they say. It gets lazy, and it was just resting just solely on the stitches at that point. So, and
it was at risk to tear.
Yeah.
Well, because the placenta could hit it and puncture it because the pressure on that. Yeah.
So then at 30 weeks and 4 days, we were at home just eating breakfast, and my water broke. And
my friend just barely got in town.
Yeah, we had
Germany.
company in town.
Oh, man.
But with none of my other pregnancies, my water didn't break on its own. I had to have it medically broke. And so that was something we'd never experienced before, and it was terrifying. And so
I thought it was funny, but
you did.
She's like, just screams, "Damn I'm like, what is wrong with you?
I'm like bawling in the bathroom. My water just broke. We got to go to the doctor. But with my other pregnancies, when the water broke, the baby was born in 30 minutes. And so I'm sitting here thinking, we're not even going to make it to the doctor. Like, this baby's going to be born and it's not going to be ready to live. And I was in a much worse state.
Well, yeah, and then here I am just kind of naive too a little bit, I think, right? Like, the water broke, baby's coming. That's really cool. Here comes baby. I'm excited for baby. But then I wasn't thinking like, oh, she's 30 weeks. Like, this baby's 10 weeks early.
Yeah.
And not a good chance of survival. Like, it's okay, but not close enough.
Because what do they say? Roughly 25 weeks is, before 25 weeks, the fatality rate is almost inevitable.
Yep.
But then after 25, then it's really, really difficult. And we're only 5 weeks post that.
Yeah. And they had kept telling us they wanted us to get us to 34 was the magic number of what they wanted to get us to. And so that I was like, that's still a month away.
I think it was
it was
still high risk.
Yeah.
Right.
Yeah.
Just like our other kids were at that, and they still had some NICU time.
So definitely scary.
Yeah. So we got to the hospital safely. That wasn't yet the story that Devin was talking about.
Still cliffhanger.
That's coming. But we got there, they checked, and they did your water really break? Yes, it did. So they started me on, they did the shot again for the lung development, which that is really painful. That's a painful one. And then they had a magnesium drip that they give the mom. And so then it helps with the baby's brain development. And so that is the worst thing I could ever have anybody go through, is having a magnesium drip. It's so painful. Your arm just feels like you're on fire. You're nauseous, you're dizzy. It's not fun. So then they were like, okay, you're not going into active labor though. Your water is broke. So we're just going to keep it still. And we're just going to watch it and see what happens.
And I was worried because before I've always heard, I don't know where, but my thought was that if your water breaks, you have 24 hours, until your risk of infection and things like that. But since she was so early, they explained that her body's still producing amniotic fluid, so it was just draining, and it was replenishing. So that's why, baby could stay in there. So the plan was just to keep her on as long as we could with her water broken, just going, and just give her antibiotics and just let it just run its course until baby came on its own.
And in every movie that we ever watch, once the water breaks, it's a ton of water, and then you take off and the baby's born within the next scene, an hour, 30 minutes, whatever.
So I was worried. I was like, well, we have 24 hours and this baby's not going anywhere, so what's going on? So that's, it was good to know, oh, well, not necessarily, because, your body still produces this. So
yeah, because I didn't know that either. Too. Yeah. So then I was on inpatient stay, just in the room there at the hospital for 6 days. And they said they've had other patients that up to 9 weeks they've had they're just in the hospital inpatient. They can't go anywhere. Their water's broken and they're just hanging out, waiting for it to be time.
Because of infection risk.
Yeah. And so they don't want to send you home. So they just watch you, closely monitor you. So we made it 6 days, which was good. But during that time, lots of different tests that they're doing and different things happened, that it was just really scary. And here we have company in town during this time.
So that's why I was back and forth from home, right?
Yeah, so Devin was back and forth from home. He's taking care of our other 3 kids on his own. And there's nothing I can do but just sit there. We also, in the time, Devin was interviewing for a different job.
For the primary job.
So it was a little stressful for that. And then I didn't know really what my leave of absence was going to do I only got 12 weeks, and I didn't want my 12 weeks to just be while I was 6 of them while I'm on bed rest in the hospital. And so I was trying to figure out all of that as well. So
intense.
It was a really, intense week.
Yeah, and juggling life.
I had to go to work.
You were working too.
Trying to juggle finding a babysitter too,
holy cow.
Gosh.
Yeah, it was an intense time. So then the day that she was born, that is it's a crazy day. So I had been up on the floor as inpatient, and I just wasn't feeling good all night long, and just was having some contractions, but nothing like consistent. And then I'd gotten out of bed to go to the bathroom, and just huge blood clots, like fist size, were coming out of me. And it soaked the whole bed and the floor, and it was terrifying.
That's when she called.
And that's when I called Devin. And so I hit the call nurse button on my bed. I called Devin, and I said, you need to come now. I don't know what's happening, but you need to get her now. The nurse walked in, took my phone, and hung up on him. I didn't hang up on you. And then that's all he got. That's all the information he got.
And then I kept calling, and they wouldn't answer.
Then they rushed me down to the labor and delivery. And then from that point, they checked me, and it was just chaotic. And he's rushing to the hospital. None of the doctors were available
when I got there finally. It like seemed like they were all on vacation or something. I don't know. But.
Our doctor was on vacation. Our main OBGYN was on vacation during the week, but it had been a busy day in the hospital. It was about like 10 o'clock when it happened. And so it was just, really chaotic. And so he got here safely, although that lady honking at him wouldn't say so.
Everyone was okay.
My mom thankfully met him there and took the kids from him. But they had checked in, and what they told us was that my cervix had torn the stitch, and that that was what the blood loss was from. But we're looking at it going, we know that's not true, because even your cervix doesn't have fist-sized blood clots.
No, not from a stitch.
But at that point, they're like, you're dilated to a 4, and you're 100% a phase. The baby is going to be born today. And so that was scary. But that's, Devin can talk about, he kind of had to get really angry with the staff of like, okay, what is this really coming from? Yeah. We need more details, because we know it's not the stitch.
So anytime she would shift or move, like she'd lose a good amount of blood, and it was scary. And as a therapist, you kind of learn how to read people's facial expressions and body language, right? And and they're trained to do, they're trained to try to keep stuff like that from you, so you're not panicking, right? And like my job as a crisis worker is to keep calm, right? And so any nursing staff and all that, they're all supposed to put a smile on and be like, oh, it's okay.
Because it doesn't help if you're in panic either. That doesn't help anything.
Unfortunately, but fortunately, I think in this case, like, I knew this is not normal. Cami knows it wasn't normal. Like, I'm not losing gushes of blood is how I would describe it, right?
Yeah.
And I said to the nurse finally, I said, this is not normal. I can see you're panicked. We're worried too. So let's not, beat around the bush. We need a doctor down here so we can get this figured out. And if you don't find one, I'm going to have to go find one myself, because this is not normal. I'm telling you, this isn't normal. I can see that it's not normal from your look. Because, I'm panicked a little bit.
Oh, yeah.
Right?
Yeah.
Cami's panicked. And then the nurse's face was certainly like, she's trying to hide it really well. But it definitely wasn't. It was not. And so she's like, you know what? You're right. This isn't normal. We're trying to get a doctor down here. And I think it was mostly because of shortage of doctors that day, or how busy it was. But you have to advocate for yourself if you know, though. Or otherwise, they'll try to keep. I think that she would have probably pushed it out a little longer, because I kept saying, I don't think this is right. And she's like, oh no, trying to reassure me. But, finally, sometimes you just have to advocate, which sucks, because I know there's many things in the background going on.
Yeah, there is a lot.
It's hard to get a lot of people together all at once and assimilated. Like when I'm working on a crisis trauma in the hospital, they page teams, but sometimes those doctors aren't immediately available. So, So I know that now, and I knew that before, but not to the extreme that I know now. But.
Well, and it's really hard if you don't know that you can advocate for yourself. I mean, you're there in a trusted place, and that's not to say, that it needs to be against somebody, but like you said, there's a ton that's going on in the background, and it's good to be able to bring that to attention, or have a doula that can help bring attention to that. But that's it's important to know. I love what you're saying.
Well, I know the nurse was trying to do her job,
right?
Like,
it's not to slam on her or anything.
So, and I could see the nurse was a little freaked out. The previous times that I said, hey, what's going on? I don't think this is normal. And so I just kind of let that be because I could tell, she's trying to do what she's supposed to do. But yeah, it was a tough experience, like as far as that went. But I was glad that we were able to get someone down there.
I think it helped us, though, because we had to advocate then for our baby later on in the NICU stay multiple times. And so I think it helped us that, like, this is how it's going to be, that you do need to advocate for yourself and for your care that you're getting. And some people just don't know that, and they don't know what's available to them.
Yeah, so. To be a little forceful or be forward. And I liked that you were going about it instead of, like, in this demanding, shouting, because that doesn't necessarily help either, but saying this is what needs to happen.
Right.
If this doesn't happen, then this is what I'm going to do.
Mm-hmm.
Yeah.
Things like that.
Yeah.
Yeah, because, I mean, like I said, we'll just let her do her job for a while and see what give it some time. But at that point, I'm like, this, that's a lot of blood. I'm no medical pro, but listen, that is not right,
Definitely.
So at that point, then we got a doctor in, and they said, okay, yep, the baby needs to come now. We can either start you on Pitocin and get your contractions going so you can go into labor on your own, or we can do a C-section in 20 minutes. I mean, it was fast.
Wow.
So we looked at each other and we just said, a C-section. Like, that's going to be the safest route. Like, she needs to come now.
Well, and we were thinking that previous to
Yeah.
I told Cam, I was like, this is going to be a C-section situation, I think. Because with our previous child, our son, he was an emergency C-section. And she didn't have any time to prepare, which was a horrific story in its own. Like, just panicked when she just briefly, when she went in to have the procedure, she was just shaking uncontrollably and just super anxious the whole time. Mm-hmm. So, we were trying to be prepared for that this time. And when I was advocating to get the doctor, I was like, you're probably going to have a C-section. So let's start thinking about that now. And
that helped.
And just, kind of prepping ourselves mentally that way. And then they confirmed that when the doc came in, she was great with them.
Oh, that's wonderful.
She was. So they, part of going back to like how I can relate it as well, of like, there's no privacy at all during this pregnancy. Like
medical the lab guy.
Like, I am getting my stitch taken out, and they're coming in and talking to me, and there's a lab tech or what do they call it? A phlebotomist that comes in. Like, I swear, like 16-year-old phlebotomist male, and comes in, and my legs are in stirrups, and everything is out in the opening, and he's like, I need that arm over there. Like. And I'm just like, come get it. Like, take my blood. It's fine. Like, just so much. Like, they said, okay, we're going to do a C-section in 20 minutes. The OR is ready. My dad was there in the waiting room, so he came in to give me a blessing. And the nurse comes in with a razor to get me prepared, and just like keeps turning it on and off. Do you remember that? Like, it was like an electric razor, and he's like giving me this blessing, and she's just like bzz, bzz, like are you kidding me right now? This is my father. Like, can you wait till he leaves the room? Like, there's just there was no privacy at all. Like, everything was just out in the open, so it's fine. I just laugh about it now,
but at the time,
that's
like, so intrusive.
Yes.
Everything is so intruded on.
And like thinking back about that, like, I'm like, other people, I hope they don't experience this too. Like,
assumptions that you need those things, like preps and all that. Like, well, you could ask first. Right? Well, this is modern times.
It was pretty uncomfortable. But so we got to the OR. This C-section, my previous C-section was scary, but this one was actually really good. It was a good time. But when they made the cut, they said a whole bunch of blood clots came out, and they're like, it was
like handfuls, like 2 hand size. Like they said once a softball size blood clot. She lost 5 units, which is their cutoff for, and I don't know how much fluid ounces, etc. It was. But I think it was like a liter or more. And they said that that is the cutoff before they need to infuse her with more blood. But
I was right on that border that they were.
Yeah, so they just monitor her overnight to see if her blood count came back up, and it did, so they didn't have to give her that. But she was ghostly and just weak and pale, and I was like, holy cow.
I don't really remember anything after,
she looked like
going up to the room or anything afterwards. It's all a blur.
Yeah, she was just...
Gotcha. So we've got physical trauma happening all the way up to delivery.
Yep.
And then so even post.
In the delivery, that's when they told us that, your placenta was pulling away from your uterus, and that's what all that blood was from. And so that was, I don't know. I did feel at the time like that was the best decision, because if we would have gone for a vaginal
said if we would
birth,
have waited,
it would have been worse.
It could have killed her because it literally tore the placenta from the uterus, and she was bleeding internally, and that's what the clots were from, as her body was trying
losing the 5 units was there.
Yeah. Wow. So yeah, she's bleeding internally this whole time. That I'm trying to advocate to get the doctor down there, and then the baby's going to be losing her supply, of blood and all that. And so they're like, it was torn. They did do an ultrasound when we were previous to the C-section, but they couldn't find a tear. They think it was underneath on the backside, and they couldn't see it there. So,
oh, gotcha.
Yeah.
They examined the placenta and said it was torn.
Did everything go okay with the actual C-section?
Yeah, everything with the C-section was good. And when you are going to have a baby that's going to go to the NICU, they actually have special ORs that have a window in them.
It's like a fast food window, man. You just pass a baby through it.
Yeah, your baby gets born, and they hold it up for just a minute. Dad doesn't even get to hold them or anything, and they just pass it right through the window. And she was immediately in the NICU then.
Wow.
So it was actually I will say the C-section was really good. They asked me if I wanted a mirror, and I was like, I don't know. And then I did. So I got to see her get born, which was actually really cool.
I got to practice some deep breathing skills for her.
Yes, she did.
As a therapist.
As a therapist.
Not the husband part. A little bit of both. But she did really well.
And they were really good at prepping us. That they had been talking to us the whole time the week before that we'd been in the hospital about, this is what a baby born, normal baby looks like, and this is what a baby prematurely looks like. They're not developed yet. They might look different than what you're expecting, and it can be scary. And so it was good to talk about all of that. But I was actually really surprised with just how cute she was. And even the doctor made a comment right when she was born that, she's actually really cute. And I was like, what are you saying about other babies?
Yeah.
Oops. I'm like, you're just being stuff.
And they warned us that she probably wouldn't cry or make any noise because she just wasn't developed enough. And so they said, just be prepared for that. Other births, the baby's born and you hear them immediately cry. So don't be panicked about that. She did let out a little squeak. Yeah, it was really cute. And then they just passed her right over. And then they cleaned everything up, took me back to the room. Dev got to go and meet her about 30 minutes after she was born.
So going through this trauma, that's one of my first questions to you, Devin, is we've had this, is it okay if I call it a traumatic birth?
Yes.
Because it sounds like it was very traumatic.
Yep.
We've had this traumatic birth going on. Mom's in 5 units low. Then baby gets passed through the fast food delivery window to straight to the NICU. What's going on in your mind? You're needing to be or maybe wanting to be in 2 places at once.
Yeah, I'm trying to be in 2 places at once, but I'm trying to focus on Cami because I know she's freaked out, right? And so the therapist part of me is like coaching her through this. Like, you got it. Just holding her hand. Just take some deep breaths. You're starting to get a little anxious, she did really well. Because I remember the first C-section, she was shaking so uncontrollably, deep breathing, none of that was even a factor. I couldn't get her to calm down, right? And anesthesia and all that and the anxiety. But my focus was on her, trying to get her through this because I knew how scary it was the time before for her.
And we had met the NICU nurses that were going to take care of her before she was born. They came in and introduced themselves. I think that was a peace of mind. I know they're doing everything they can for her. We've done everything we can up to this point, and she's in good hands.
So it was helpful to have the trust.
Yeah.
Just like, okay, NICU people are doing what they need to. Let's reestablish the base.
Yeah.
You two.
Yeah.
Yeah. So after the baby was born and got passed through, they said, you have some time. And I was like, okay, so we'll go back and just make sure Cami's doing okay in recovery. And then I got a phone call offering me the job to go work at primaries as soon as we got back to the room. This baby was just born and I'm about ready to go see it, but here's a job offer. So I took a job offer.
Holy cow.
And then
life doesn't stop.
Yeah. No. Then I got geared up. Yeah. So it's just like this one thing after you just taking one moment at a time, and so then I got ready and they told us that we can go see baby, and Cami still had something. I can't remember.
They just were monitoring
her.
Stuff,
because the blood. They were just making sure she was okay. Yeah, I mean, she did not. She looked like a Walking Dead. I guess all I could say. She was just super pale. So I got to go see baby.
You and my dad went and met her first.
Went.
Yep.
Yeah.
Got to see her.
It was incredible. She was just as... She was actually born... How
so she was
like 4'9"? 4'13"?
Yeah, 4 pounds, 3 ounces.
Oh, 4'3".
And she was 17 and a half inches long.
Wow.
She was tiny still.
Tiny. But
really healthy because of, for how early she was. That's
with like all the shots.
Yeah.
Almost,
we had
close to 5 pounds is amazing.
We'd had 3 shots of the steroid at that point. We'd had the magnesium drip going for a while. So she had a good way to get there.
You got some, I think even when we went and visited her and you guys, that some of the ones next to her were like,
oh, man.
like 2 pounds. 1.5. There was those like some twins or something like that were very, very low weight. And I mean, anywhere along the spectrum as we kind of get to talking about the NICU and stuff. I mean, this is babies of all different
when we
issues
get there
and
in
sizes.
that part of the story, I'll tell you kind of how I feel about as far as like the struggles with the NICU too, but the excitement and then you can't be too excited. But But yeah, so we got to visit. I got to visit baby first, and it was awesome. She looked really well. She didn't require like any oxygen. Most babies, preemies can go on like a CPAP machine or just a nasal cannula.
She had the nasal cannula for a couple days.
Not the first day, but then the second day she started it for a day or two. But yeah, she was doing really well. Mom got to come see her, and then that was kind of the birth. She got wheeled in her bed and got to see baby.
Yep. Yeah. So then after that, she was in the NICU for a little over 5 weeks, like 5 weeks and 3 days. And it was it's hard. It's hard being in the NICU.
Yeah.
Your life still goes on. So you have 3 other kids at home. Well, we had 3 other kids at home that we're taking care of, and a household and animals and
house guests still.
House guests still.
Yeah, because they're from Germany. They were there for a while.
Yeah. And we're just, living life, but then you want to go see this baby. You just had this baby and you want to have a connection with them, and it's kind of taken away from you.
Yeah.
And just juggling that, it's hard.
Yeah.
It was a lot more, it was a lot harder than I thought it was going to be.
Yeah, well, because you have guilt too, because all this daily, big time guilt, because of daily life, I have to be to work, we have to go to daycare, we have to have the kids in school. But what about baby? And you're just trying to struggle to juggle the schedule so well. And then every dying moment then the attention is on baby when you're trying to balance the other 3 children's attention to them.
And there's some guilt surrounded with that.
Yeah, there's guilt that you can't get to the baby every time. And the first day that we didn't visit the baby at all one day, oh my gosh, I think that was one of the toughest times for me too, because it was
the 24th of July. So she was born on July 14th.
Yeah.
Oh.
Her due date was September 11th. But on the 24th of July, we wanted our other kids to feel a little bit of normalization. So we went and did some things with them, and the day just got away with us, and we wanted to stop and see her, and we just didn't have time. And getting home that night and realizing we didn't get a chance to see our baby. It was hard.
Yeah, it was really difficult because, the NICU nurses were really awesome at saying it's okay. We know that parents, sometimes can't make it, and you guys should take a day once in a while. But no matter what, even with that reassurance, you're just like, no, we got to go see baby.
Yeah.
Right?
Well, and you can always call and check in. We checked in with her a couple times that day and made sure everything was good, but just not being able to physically see her.
Yeah.
Yeah, you feel like parent failure, kind of like, we didn't go see our sick baby, who could potentially have an issue at any moment, in a NICU setting.
Dealing with failure, guilt, what the expectations you have on yourself, or how you demonstrate love to this new child that you can't take home or even really hold.
Yep. And that's...
Yeah, we couldn't hold her for a long time either. So.
I didn't get to hold her until she was, 6 days old? 5 or 6 days old. And Devin didn't get to until about 2 days after that. And even still, just everything was so completely different than with a normal, healthy baby. The way you hold them, the way you do everything with them is just different. They're fragile. They look healthy and normal. They look just like a little baby, but there's so much more going on with them that you just don't realize. I think that was a hard thing with a lot of our family. They supported us a lot, but we had, multiple people say comments of, different things of, I didn't even get to see her when she was in the NICU, and I never got to see her that, like, you never brought me down to meet her and things like that. But you've got to advocate for your baby, and you can't let her see everybody because she's still just developing, and there's still so much going on that you can't. If she got
sick or anything.
Yeah, like she wouldn't have been able to fight it off. Yep. And I just don't think a lot of people are aware of that as well, even though she like pictures online or that we send around, she looks healthy and fine, but she's not and that's hard to comprehend.
Definitely.
Yeah, it was an interesting dynamic trying to balance all that.
It'd be a very interesting balance to be going through, as well as feeling all these feelings. I can just imagine that in any situation, your situation, we're feeling, the guilt, we're feeling all these different emotions that are coming up. And then I'm thinking of so many other people that have gone through a similar situation, or even just being in the NICU. Just being in the NICU brings its own level of each person in there is going through their own specific.
Oh yeah, totally.
And you become a little community in there.
Yeah.
Yeah.
It kind of goes into like where I was going to say, like, you're excited to have your child that's healthy, but you can't really express that. Like,
oh no, because there's so many other people that are worse off.
Micropreemies, and then you hear prognoses, like you're all in a pretty close area, so you can hear that this baby next to you is not going to be doing so well. So then, as a parent, you want to be excited that your child's doing well, but as a decent human being, I don't know what else to say. You don't want to be the person that's like bragging about your child when someone else's child's dying, so.
Because it is life and death.
Yeah.
Mine's starting to live more. I hope yours is doing the same, but.
Yeah.
And that's kind of what you said. Yeah. Like, how's your baby doing? Well, I hope it's doing good. Or like, they're like, not great. And we're like, man, sorry to hear that. Is there anything that we can do for you? And just trying to be mindful of not like, I don't know. It's a weird balance.
That is a weird balance.
It was a weird balance.
Feeling like you can't celebrate all the way.
Well, and I think I had a lot of like anxiety over it and stuff that I'm still healing from this traumatic birth that I had. And I just feel like my milk's coming in now and I'm healing and I can't feed her. And just all the stuff going on with my own physical health that I felt like, okay, I don't even want to take care of myself because I just want to be there for her. But like how to find the balance of that, like you've got to take care of your own self as well and be there for your child. And
definitely
it was a hard balance.
Well, I remember Cami feeling helpless, but so when she first got her first what is the first milk? What's that called?
The colostrum.
Yeah, colostrum.
Yeah.
She was so excited, right? And she's like, "This is how I help baby." And she was just like, "Game on," right? Like, and anytime she got some, she'd make me like run it down there,
because at that point I couldn't even hold her. Yep, I'm
she's
like,
you bring this to the baby right now.
It was the only thing I could do for her. Yep, like I'm like, we're with every other birth, I get to hold this baby and protect him, and I couldn't do any of that with her. This colostrum was the only thing I could give her.
The only thing.
Yeah, so
it was like Son for Superman, dude. It was and she would make me run it down, even though I just thought it was so funny. She's like, "You got to bring it down," and I'm like, "They'll come." No, bring it down. I was like, "Okay, well, I'll just go
and
bring
ready
it
for her.
Doing it right now." So as you're sitting in the NICU, I imagine there's a ton of things that are going through your mind and everything like that. What were kind of some of the conversations that you had while you're in the NICU?
One of the biggest things for me was like, this is so traumatic, and I'm watching my wife almost die in this, losing all this blood and then going through this process of C-section again, and like how chaotic it's been just running back and forth the whole time. I'm thinking, well, like, are we going to have any more kids? And for me, it was a hard no. Like, I don't want to do this, but I know Cami had some other thoughts to it. But I was like, sign me a permission slip so I can get a vasectomy because I'm going to go get it done this week.
You were into it. Just get this done. We're never doing this again.
Yeah.
I didn't want to.
And that was like a conversation right in the NICU that we had. Like, I want to go get a vasectomy right now. What? But I mean, there's no way looking back on it now that in the moment, I wasn't for sure, but now I know, no, we're not having any more children. We can't do this again.
Mm-hmm. She was pretty sure in the hospital too, even though the shock factor. Then she's like, you know what? Yeah, I can't do this again. I know I can't, although, there could be a beautiful child in the future. Like, this would be so rough, it just wouldn't be worth it. And she, she expressed that. But also, dads have to advocate for themselves, too. And, when's enough? This is 4. The last 3 pregnancies have been getting progressively worse. And this is so stressful just for me to try to be balancing taking care of the other 3 kids and trying to entertain a house guest and run back and forth from this NICU and try to spend enough time with this baby and be supportive of my wife. And
to be feeling in kind of a helpless role too. What else are you supposed to do but watch the birth happen and watch all this stuff happen and then react.
Right. And then trying to work on top of all that.
And then work.
It's just I cannot do this mentally anymore. The emotions were just out of control.
For our family's well-being too. I mean, we got to think about the other kids as well. That we couldn't put them through that again.
Yeah, I imagine that can be really difficult if living in Utah when the question is, when's the next baby coming?
Mm-hmm. Oh, we get that all the time.
Do you?
We'll have to say it's not. We're done. That was too hard, and then people, oh yeah, it was hard.
Especially grandparents, they forget that stuff quickly.
Yeah.
Yeah, but there's no way we could do that again.
I think this is probably another great learning moment of on the list of things Braxton says never to say, with the at least probably don't ask people about when they're having kids or if they're going to, especially when it's just kind of a willy-nilly, where are we going to go eat lunch? When are babies happening?
Yeah. Exactly. Well, and I think for my part as well, I think what helped me come to the sense of enclosure of no, we're not having any more was thinking about going pregnant and doing that again. It's like PTSD. It would be so hard to go through that again. I would be on high alert from the minute I was pregnant, which I wouldn't want to do.
Well, then I know 10 weeks of bed rest is coming, and we'd have to do cerclage right away. The doctor told us, if you do it, the very first thing you're pregnant, we're cerclaging you right then.
Yeah, I bet 12 weeks would be the earliest that they would do it.
When they were doing that. Yeah. And that's not to say that that's anyone else's experience, but I think it's really important that you're taking into account your physical well-being, your emotional, your mental, even bringing
family
dynamics to it.
And other people asking when you're having kids are not thinking about all of that.
And even prep, if say this is child number 1 and you go through this traumatic experience and you're like, well, the plan at the beginning was 2 or 6 or whatever it is in between. Recognize that there's probably some work to be done in between that.
Well, and it's okay to give yourself permission to experience that.
Yeah.
Right? You can't beat yourself up for your physiological struggles, but you do a little bit. Mm-hmm. However, you got to be able to explore it and say, if I'm willing to take this chance, and so be it. I think we can get a baby to term again, but it wouldn't be without a lot of work and a lot of heartache.
Just to say that we wouldn't do it doesn't mean somebody else couldn't or wouldn't.
Definitely. And that it's just good. I love that you're bringing up, keep it in mind that it would probably bring up some symptoms of PTSD and huge reactions on an emotional, mental, and physical level that if you're planning on getting pregnant again, seek out some therapy, seek out planning, talk to doctors prior to, prep yourself for what could possibly come, even though it's impossible to prep for everything.
Yep.
As you listen to the other podcasts about postpartum anxiety and depression stuff, were you experiencing some of those symptoms as well?
I realize now that I was. In the moment, it was just in survival mode. I just was going forward, trying to do the best I could. But looking back on it, it was actually her first birthday, the heading up to her first birthday, that it was PTSD of oh my gosh, I can't believe all this stuff happened. And thinking back on it, and that's when it hit me that wow, I need to work on some of my mental state, and get it back to a good place, because it was a lot going on in the moment, and I just, I didn't know how to deal with it.
I didn't notice a lot of postpartum. I noticed she was a little more secluded and probably a little more depressed than normal, but
which is also understandable going through what you went through as well. Kind of hard to decipher.
Yeah. Well, and myself, I was probably, still having some of those symptoms too, but not notice internally. And I was so focused on work and everything else that you don't have time to kind of reflect on that. And then she had to go back to work early too. So it was, like baby was still recovering and not old enough, and she had to and she was back to work. So I think some of that.
My medical leave was over.
We used half of it up before baby was even old enough to go. So
to come home. Yeah. So, but I think like a big part of it was like, that I related to was even like the financial burden. Like going through this high risk pregnancy, those shots were so expensive. They were out of pocket that we had to pay for.
And the university is the only one that makes them.
Yep.
So it's, you have
out of network for us. And so we had to pay for those out of pocket, which I can't remember. I think they were like $75 a shot.
Yeah, once a week.
Which was weekly. And then, we were out of work for so long, and the hospital stay was more. Her NICU stay for the 5 weeks was just over $1 million.
Wow!
Which, thank goodness for insurance, we didn't have to pay $1 million. But I mean, we're still on a payment plan for her.
Yeah,
she's almost 19 months, and we're still paying that thing off.
Paying the birth.
But it's a huge financial burden. That I mean, most people that go to the NICU don't even think about that part, and so they're not planning for that. Most babies that are born prematurely, you're not planning for that or expecting that. And so to have that financial burden then that you have to deal with, it's hard to come up with, and if you're not prepared for it.
Well, it's that subtle reminder every month too, right? Of this like trauma.
This trauma you went through. It's like,
every month you're paying for a trauma. Essentially, like if you put it in that term, right? Like,
totally.
Just because it's that reminder. But, you have to do a lot of reframing, right? This was like, this saved our child, and this is, like without the NICU, holy cow. I mean, obviously, like it wouldn't have been great, but they were so amazing, and they did such a great job and just reinforcing us, and telling us step by step what was going on. And some of the clinical social workers in there were telling us, these are some things to expect. And to me, like I was saying earlier to you before this, was like, to me, it seemed like no-brainer stuff, but because I'm trained to do that. Right. And so to Cami, she's like, oh yeah. And I'm just like, yeah, I mean, duh. But she's like, oh, that really made a lot of sense. And I was like, I already told you that. But, the social workers were there. You get to pick your own nurses. Okay. You have a couple nurses, and they
primary care nurse.
Primary care nurse. Yeah. And so
what were some of the things that they told you that were kind of no-brainer, but
just kind of like, you're going to experience probably some, they kind of told us like, you'll probably experience some of this push and pull, like some of this guilt and shame for not being able to maybe be here. That was like some of the coaching they told you.
They talked a lot about like, because we were excited about certain milestones that she was hitting, and we knew the milestones meant she was coming closer to coming home, but we didn't feel like we could celebrate them because there was other babies right there in her same room that were doing worse off, and so we didn't feel like it was appropriate to celebrate or be excited about it. And they talked to us about that. About
celebrate.
You do need to celebrate. Be excited about it. And some other things they talked about was just like advocating for your care, like because we had certain times that we weren't happy with certain care that happened or things like that, and the social worker came in and talked to us right away about that. Like, you're going to have, some nurses that you ask to do things that they don't follow through, or different things. And she really helped us navigate that one.
Yeah, really well. And you're hyper vigilant about this kid, right? Because the kid's so fragile. And so any little thing that you're sitting there, all you can do is stare at monitors all day when you're in there with your baby, right? And what levels are good or not. And then, so you're hyper aware of like all the little things that could go wrong. And, sometimes, to us that aren't medical pros, right? But we know the monitor, they'll come in and, like there was some, I can't remember exactly what it was, but there was something going on and then I was like, we called the nurse and they're like, oh, it's no big deal. But it was a big deal to us, but they just kind of were passive about it and didn't really acknowledge some things. So that's what we're saying, like not the best things, but to advocate for what you thought, was important. And so
knowing that you can advocate for yourself is really important.
Yeah. And it's just, even if you're not a medical pro, if you still feel something's not right, then
at least ask questions.
Your instinct is also, like you have a parental instinct that's pretty great, right?
Yeah.
Like, if something, and plus you're in there is a lot of the time and they're busy with the other babies, but if the baby makes a different sound than normal, you're like, that's not normal, right? So it's good to speak up if you think that something's not quite right, no matter what. Even if you're wrong, it doesn't matter, and they'll give you an answer most of the time, you know?
I think everything is during the NICU stay is so medicalized. Like,
it's not personal.
Well,
some people make it personal for you.
Yes, they do. But like the verbalization and the machines and everything, it's just like, I don't know. It's a disconnect of like you just had a baby, but then you can't like even hold them or help them. It's just all these beeping noises, the machines hooked up, and people coming in and out and saying things that you might not know. That you do need to advocate. Speak up if you don't know. Like, what does that mean? What is the baseline? What are we trying to get to? What's a milestone that we should be looking for? Yeah. And I think that really helped to be able to know that and speak up for that, because then it made it bearable.
Yeah, I think part of it is that they weren't trying to get to a milestone that was supposed to be. They were supposed to be taking actions to get to this next milestone, is what the thought I had earlier, but they weren't really engaging in that, and so we had to ask a couple times to start the process of a certain milestone that we were doing, and they weren't. So that was one of my frustrations, is like, we've already hit this milestone, the next one's here, and we're just kind of wasting days here. Like, I'm like, I want baby to do better. Yeah. And that was one of the frustrations that I had with that.
And you're able to step in and say, hey, let's get things moving. And that was helpful.
Yeah. And then they started, and if they couldn't start because of a certain lab, I think is what it was, like a lab draw they were waiting for, and they couldn't start doing, I can't remember exactly which one it was, but it had to be that they were waiting, but they didn't communicate. So I said, let's start communicating better with us. And like, as a therapist, communication's huge to me, right? Part of the side note is like any type of communication that's not, like right there when I need it, it's like frustrating to me.
Definitely.
Definitely. Tell me what's going on. Don't beat around the bush. I can tell that you're hiding something. Like, it's pretty obvious to me.
Definitely. I think one of the things that when we were talking, months ago, Cami, that stuck out to me was these emotions or these experiences that you were having afterwards, or as you were listening to the podcast. You're like, whoa, I felt that. Yes, I felt this way. Oh, I was experiencing this worry of loss, or the distress, the anxiety, the maybe even nightmares, things along those lines, that you also felt that you weren't able to express that, or that there wasn't even a community about that.
I don't think that there is a really good platform for like high risk pregnancies, because I feel like I would say things to some people, and I've gotten like during the pregnancy that like, oh, I got the cerclage surgery. It was really scary. And, I had people say like, oh, well, at least you got pregnant though, and everything will be fine. Well, that's awful. Like, so then I felt like I couldn't say anything more. And we have people in our, close to us that can't get pregnant at all. And I don't have a problem with that. I can get pregnant, but we also have had other people lose their babies, and we watched that in the NICU as well. And so I just felt like there wasn't really there's not a really good platform to say, I feel some of these same feelings or some of the same situations. It's not the same. I can't say, oh, I know what you're going through, because I don't, but I can relate. And I just don't think there's a good place to say that.
Yeah, that's what struck me the most, is when you were telling me that, I could see how silencing it could be, because it's not to put down the number one thing, especially in this episode, why I really wanted to do this episode was because so many people go through this. Guaranteed someone has felt exactly the way that you felt too, that we've talked about, postpartum depression and anxiety and all these mood disorders that can happen after baby that happen, and they happen frequently.
Yeah. Well, and they're more common if you go to the NICU.
And they're more common if you go to the NICU. Yeah. And they're more common if you've got traumatic birth and things along those lines. And then also we've got fetal demise and miscarriages and infertility issues that come up, and also losing babies to SIDS or just losing a baby in of itself. And then right here in the middle, you have a baby, you're experiencing all of these similar emotions, and someone can say something along the lines of like, well, you have a baby, like now you should be happy.
Yep.
And that's not correct. It's not to try and diminish anybody else that has lost a baby. Like that is
what I'm trying to do. No.
It's also not to forget you or to forget that other people have experiences, also have a baby, and then also have a ton of things going on that affect mental health, affect emotional, affect physical well-beings.
Yeah, we had other comments as well after, while she was in the NICU of, we didn't get to come see her, or we want to come see her. We had even people show up at the NICU and we're like, we're ready to see her. And we had to say, no, we're not taking you in to see her. That was hard. But then we've had other, like when she was in the NICU, they were like, how long is she expected to be there? And I said, a couple more weeks. And they're like, oh, good. You can rest up and sleep all night. And you don't have to worry about any of that newborn stage. And it will be covered and she'll come home and then she'll be out of that. And I was like, oh my gosh, I didn't even think about that. And that's awful. I don't want to miss the newborn stage. And so like comments like that, even though you don't mean them to be rude or, they hurt. We also had some funny experience now when I think back on it with a neighbor that we were just in a bad state of mind during that time, hypersensitive, I think. And we got in a big argument with one of our neighbors about our dog. Like looking back on it now, I laugh about it, but I'm like,
we got bigger fish to fry than you worrying about our dog being on your lawn right now.
So I'm like, just be sensitive to people and what they're going through.
Empathy, right? Like we don't have to be able to know exactly what someone did. And that's why we say like in therapy is like, you try to have some empathy, try to put yourself in their shoes and try to experience what they have or kind of relate on similar situations, right? So our experience was not the same of loss or anything like that, but we certainly, I think, went through those emotions, and I've seen some emotions that it was like essentially grieving a living child at times.
Grieving a living child,
which is tough, because at any moment and just being worried, and there was also that sense of like, should I be getting attached right now to this child? Like, my guard was up as far as that goes because, well, if this baby could potentially not be along, how deeply involved can I get?
Yeah.
So, and then you feel guilt about that, right? Like, so I would say like going through, there's like a grieving period when you're in this NICU stay that for a living child, which is really weird. The emotions were so strong that you just try to get on the same level as others. And I cried for the people that were next to us because you build some type of a relationship, and that child was gone. But we've built friendships with. I mean, we're still in contact with people that we were in the NICU with, and it's kind of its own little tight knit community now. But
it really is. I think that from what I'm taking from what you guys have been saying is, one, it still comes to rule of thumb or the way that things are. If you're going to say something and you start it with at least, you probably shouldn't say it. For anywhere along the spectrum of well, at least blah. Really check in with yourself and say, am I saying this because I'm uncomfortable right now? That tends to be the number one reason why someone's saying at least this. Like, I can't help you. I can't take your baby out.
In the episode with Monica, I really related to that when she said, if you don't have anything to say or you don't know what to say, just say, I'm sorry.
Or I don't know what to say.
Yep. Or I don't know what to say. Yep. Because that would have been...
Or what can I do to help you?
Yep. That would have been much better. And I don't want it to be like this negative thing, because there was a lot of good. During our time, we had a lot of support and a lot of help, and we couldn't have done it without all of that. But I think a lot of it too was just finding that balance of advocating for myself, or like for what our family needed, as well as what we needed to do for this baby, and asking for help. It's hard to ask for help, but saying, Braxton, will you take care of our dog for a week while we're figuring out this baby? It was great. Like, it helped us so much. It just eased our worry of it. People brought us food and stuff, which was great, but we weren't always home. So then the food just got wasted. Like if they would have asked, I probably would have had something better they could have helped us with. Like, which, not to say I'm not supportive or thankful for it, but
great to build that communication.
Yeah, I think it would be a good thing if you know somebody is going through something, ask them. Just open up that communication. What can I do for you? You know, I'm sorry you're going through this, but what can I do?
Not only that,
and I'm
but
sure
sometimes
they have a list.
and sometimes you don't know what you need help with.
Yeah.
So you could say if someone had an idea, they could present that idea. Like, I wanted to bring food. Would that be helpful?
Yeah.
Or I wanted to, watch your kids for an hour. Could that help? Bring ideas, because if 9 times out of 10, if someone's like, what can I help you with? And it's an empty follow through, then, or, like a open-ended
you're not sure
thing.
In the moment. You guys are thinking
we're going to say nothing.
Got to see baby, got to go to with, my partner. I've got to get this. I've got to go to work. I've got all these other things. You're taking it moment by moment to think, 4 hours in the future, this would be helpful.
Yeah.
That could be really difficult in the middle of crisis.
Maybe
You're working
have
crisis.
suggestions, right? Like, I don't know.
Yeah.
Maybe that's a little picky, but I mean, the gesture of saying, hey, can we help you? Like, that's great. And it's good to feel supported.
Yeah. How did you guys end up supporting yourself? Like, it's hard to say this, but how did you end up doing your own mental health and your own self-care and all this? Was that present?
One of the best things was, Charlotte was about 2 weeks at the time. Somebody gave me a gift card to go get a manicure and pedicure. And they were like, I know you wouldn't go do this on your own, but go do it. It's already set up. The appointment's set up. I've already done it. It's already paid for. This is the time. Go do it. And that was awesome. Like, it was time just for me to go and focus on me and not feel any guilt about it. Like, everything was covered. And I didn't worry. I didn't have to worry about setting up the appointment or seeing what time would work or anything like that. They did all of that. I think that was really cool. But I think we just talked a lot.
You two talked a lot.
Talked to each other a lot. Talked to friends and family and support a lot. I talked to a lot of coworkers, obviously, because therapists are helpful.
Therapists are helpful in these moments.
Like, as a therapist, though, you can't therapize your own family very well, and it's not healthy. So, I'm like, just talk about how, and just being there. Like, I know that's hard, or, I experienced these experiences with you, and it's not fun at all. And, just really kind of like, wow, that nurse was really helpful today. And just celebrating the milestones and really knowing what we did as a family to really make it through, and just kind of reinforcing those big changes that we were able to do was good. And then
I think I struggled a lot with wanting the kids at home. It was summer, and I want them to feel like they were having fun too. Like, we didn't want just them to have resentment towards this baby or things like that, So I don't know. We did a couple things, took them out to the movies and things like that, which was good. Focused on just them for a minute, because they were worried and scared too.
Yeah.
So
I'll bet they were.
I think that helped, and gave them time to not focus on it for a little bit.
And then for for babies 1 year, I almost said anniversary, birthday. We can say birthday.
It's the same.
It's kind of like an anniversary as well.
For 1 year anniversary. But for birthday, you guys had donations given to NICU.
So that was actually our girls' ideas. So they were 9 and 7 when she was born. But we passed the hospital every day, multiple times, and they just call that Charlotte's Hospital now. So, and it was at Christmas time that they asked, what do babies do at Christmas time when they're in the hospital? Does Santa visit them and things like that? And so I said, most people, I've seen people do donations and they bring in things, because most people aren't thinking about Christmas if their baby's in the hospital, and Santa still comes and visits. But they were like, oh, well, we want to do that. So I said, okay, we can do that maybe for her first birthday or something. And so that actually kind of got it rolling, and we set up an Amazon wish list.
The wedding registry is how it had to work.
Yeah, they wouldn't
Speaking
let us they wouldn't let us do the baby one, so we had to do it as a wedding anniversary. But we set that up. We went through it with the kids. They decided what they wanted to do, and they said, they wanted to do packages for the parents, for the family. So
Little things like brushes and toothbrushes that made a huge difference to us when we're sitting there, like, can't take care of you, like the smelly kid of the classroom because you're so busy trying to be back and forth from the hospital. And,
little travel deodorants is what we put in it, tissues, a journal, because I journaled a lot.
Milestone cards.
Yeah, milestone cards. We did... What else was in there?
Put like a treat in there.
Granola bars and things like that.
Because you forget to eat sometimes because it's so busy.
Well, and you're not supposed to have food in the NICU too. And so you don't want to leave to go get food because you want to be there with them. So then, there were some days that I wouldn't eat until I got home after being there all day. And so, it was really fun. And it was actually really like a peace of mind to go and take the kids then and donate. We ended up donating 12 bags. Full of just stuff, and then blankets and onesies as well, that we just went and brought to the NICU and got to see the NICU, and it wasn't a scary place anymore. It was
it's also part of closure for you guys.
It was a good closure.
It was really good.
We're grateful for all the people that donated to that too, because it's a great cause. Like anything that people can do to add a little comfort. We got some little things that they seem minor in the time, but they were huge, like a toothbrush and a toothpaste, like seriously. And we called the NICU as well before to ask what they wanted, because any good research project, you asked what the client needs, right? So we called and asked, and they gave us some ideas, and we added some of our own, that like dry shampoo, things like that, right?
Nice.
But it was great that everyone participated for that instead of taking gifts for a 1-year-old child that we all know really won't remember, right? But some clothes and things like that. It was awesome.
It was good.
And you've also been doing a lot of other research on like who's doing. Tell us a little bit about what you've seen on Instagram and.
So that part, I didn't feel like there was a good platform to talk about any of this, and so I was just trying to find anything that I could relate to, and I found a really good parent support network on social media. Where on Instagram is where I found most of it, but it's on Facebook as well. But none of it is in the United States. It's all in Australia. There's some down in the UK that I am in contact with, and just writing people, and they write their stories and send in their stories, and I would send pictures of Charlotte to them, and they would respond back of, their baby's in the same milestone and different things. Because even after she was born, even though she was developed and she was healthy, her milestones, that normal age milestones, she wasn't hitting on time.
Yeah, she's a month behind.
Because she was early, and so that was hard to see and hard to deal with, and being able to reach out to this, parent support that they're going through the same thing and their kids are doing the same thing, and being able to feel, you can relate.
Yeah,
it was great.
Do you have the names of them?
There's one from Minnie to Moose is what it is. And it's two parents that had babies born at the same time that found each other in the NICU and then started the support group.
Yeah, it's on Instagram.
On Instagram. And then there's...
what was the one that they make the baby?
Yeah, that's the one I'm trying to find.
That's when you're thinking of?
So she actually does whole donation things every month that she takes to the NICU. Every month she has a Amazon wish list as well, I believe, but just every month you can donate to her, and she makes onesies and things like that she donates, and that's kind of her closure of I just want to continue to support. But then she also has a shop that you can buy milestone cards in, or different things specific to premature babies. But then she has these dolls that you can make that are the same birth weight and length as your child, which are really cool. So.
Yeah, looking at it, when you put them next to the baby, after 6 months or after a year, after 2 years, you're that's how big the child was.
Well, I mean, we keep, you keep little outfits. We had a micro preemie outfit that was drowning her, when she was born, and the preemie diapers were huge on her, and you just, it's hard. You look back at it now and you're like, holy cow. And then she was still big. So it's hard to remember some of those things, the actual sizes. So I think that's a great way to kind of remember that. And, with trauma, you block a lot of things out because it's just, it just reinforces your body's automatically protecting itself, and it's trying to just dump some of that memory that, isn't necessary in the moment.
Right. Yeah.
So
I think one of my favorite parts of what you guys are talking here is that as time has gone on, and even in the moment, finding where the clarity or whatever is best for you in the moment, to find the clarity or the closure is the word I'm looking for. whatever works best for you, whatever is going to help you work through the situation is great. I mean, even as being dad, a lot of the times I think of, okay, I've got to be the sturdy oak that hunkers down, and mom's in the hospital, baby's in the NICU, I'm traveling back and forth, I don't have time for me.
Yeah.
But how do you make your closure as well as take care of yourself, as well as mom taking care of yourself, and then year afterwards experiencing all those? Like, there's so much. As I've prepped for this and started talking to other people, what I found the most is that your experience is your experience, which is going to bring up very similar emotions. As much as there's a YouTube channel called Meet the Millers, and they're going through their experience, and now that they're out of the NICU, they still have to have like a feeding tube, and there's still a lot of other things that are going on, and they're documenting what's going on with them and their baby. And even my brother, they were in the NICU and they were full term. And so they're like, oh my goodness, like, how do we even deal with this? We have a full term baby, but we have issues that are going on. And how do we deal with that when there's a lot that's going on within the NICU, and so taking care of yourself is so important.
Definitely.
And if you don't know who your support is, you can always find a therapist, right?
Totally. Yeah.
You don't have to try, if things aren't working at home, then reach out to someone that doesn't know you, that's in your circle so much.
That can be there
important
for you.
And I will say at our hospital that we were in our NICU, they have a parent support volunteers. So you can actually go and volunteer and be there. You can help hold the babies. You can help with cares and things like that for other babies.
And when the parents can't be there sometimes.
Yeah, which I think
awesome.
would be a really good closure. And then they also do like yearly anniversary birthdays, and what is it called?
It's like a reunion.
Yep. So they do like a yearly reunion every year that everyone that was in the NICU can come and show their progress and celebrate it. And it's always at some fun places like the museums or things like that, which I think is really cool, and be able to continue that network. When we were in the hospital, it was they actually weren't doing volunteers at the time because there was a big system change happening at the time when she was born. So we didn't really get connected too much into that. I wish we would have, but it's a really good thing that they have. And talking to my team now that I work with, it's really unique that not all hospitals have that, but you could start it anywhere. Just go and ask the hospital if you could start a parent support network.
Wonderful.
And what would happen, or what would need to happen to get that started. So.
What advice would you give to parents that have gone through this or are looking to go through this, or possibly have to go through it?
I think my advice would be to research. Like, although it's scary to see what is going to happen and what can happen, it was a big ease of mind knowing that. We had advocates on our side helping us. The doctors were giving us information every doctor appointment. If she's born this week, this is what's going to happen. If she's born, at 30 weeks, this is what would happen. They had books that they gave us to read and things like that, which it helped ease some of that anxiety and worry. So if you knew you were going to have to do that, you could pre-plan for that. If you don't know you're going to do it and can't pre-plan, I would just say reach out to any support you can have. There's so many people that would be willing to help, and just letting them know what you need help with. Even if it's easy things, take my dog out to the bathroom, so I don't have to go home and worry about that. We had gift cards of gas given to us because driving in every day, it was like a 20-minute drive to go and see her, that adds up on gas that you're not expecting. And so it was just little things like that that people would be willing to give and help you with. So asking for help and then being empathetic. I just can't say that enough.
Yeah.
I'd also say another good thing is make sure you're comfortable with your treatment team. If you're not feeling comfortable with your treatment team, ask for a change in that. And it wouldn't happen overnight, but if we didn't like a certain nurse, we'd ask if we can have a different one, or, just really speaking up so you felt comfortable, because any little thing in those moments helps a lot. But also trusting your treatment team, because just because I didn't like how the nurse wouldn't communicate doesn't mean she didn't do her job exceptionally well. She did, but it wasn't personal. So that was my own discomfort. So speaking up for your needs, but also trusting the process, it's huge. Just make sure you have that support that way too.
Definitely.
Just talking to the social workers that work in the NICU, they said the PSI, so Postpartum Support International, and there's a Utah chapter if they're local to Utah, but they're just really helpful. It's a website that you can go to and find any, postpartum needs that you might have. Really helpful. And then that parent support volunteers and network that we talked about earlier.
Nice.
So
great. Well, I really appreciate you guys being willing to share your story as well as the insights that you have uniquely working for NICU as well as being a therapist and going through this experience. So I appreciate you coming on the show today.
Thanks for letting us share it.
Of course. Thanks.
Definitely. Thank you guys so much for tuning in. This is Birds and Bees podcast. We'll see you in the next episode. Wasn't that a great interview? Man, I love interviews like this. Remember, we love when you send these episodes to your friends and family. There's a good chance you know someone who could use some extra support or the information that was just discussed in this last episode. Send them a link, tell them about it. You can send it through iTunes, send them the birdsandbeespodcast.com link. Any way that best will get them the information, and it can help a lot to those that you love. We really appreciate you sharing this. Please consider leaving us a review on iTunes. That helps us immensely with getting this content out. And know that I love you. Love the fact that you guys are helping me out with my goal in sharing this information with the entire world and changing the way that we talk about sexual health and changing the interactions we have with our kids as well as our partners. If you have any questions or you want to join the conversation, send me a call or give me a text at 385-449-1818. Send me an email, birdsandbeespodcast@gmail.com. All this is going to be great. Love to hear from you, Hive mates. And I look forward to talking with you guys in the next episode. So until then, keep the sexual health buzz alive, and I'll see you in the next episode.